Welcome to the Simply Financial podcast. I'm your host, Christopher Calandra. Today's episode is the third part of the three-part series that I've been doing with Nationwide Retirement Institute. If you've been listening, and hopefully you have, the first part of this three-part series was on Social Security. My guest was my brother, Stephen. The second episode was with Roberta, and we talked about retirement, women in retirement. And now this episode is going to be healthcare costs in retirement. So the Retirement Institute has been gracious enough to make Tim O'Mara sit and speak with me today. So Tim, thanks for joining me.
Thanks for having me. I appreciate it.
So let's talk a little bit about healthcare. So I am a certified financial planner. I've been in the business 29 years and worked with lots and lots of people over the years in preparing for retirement and working with them through retirement. And one of the things that has stood out to me is how little thought goes into healthcare costs. People, and I'm stereotyping, you say, well, what would you tell me about your spending and your budget in retirement? And they're going to talk about, I want to see the grandchildren, I want to travel, I want to be able to do what I want to do, maybe eat out, play golf, whatever's important to them. But they're usually, at first glance, not going to talk about healthcare. And I think there's some reasons for that. Number one, it's not really the funnest topic.
Correct.
But despite it not being fun, it is incredibly important. So can you talk to me about healthcare in retirement? How important is it in the budgeting, the forecasting of what you're going to need to spend money on in retirement? Can we start there, please?
Sure. And I agree with you 100% in talking with folks approaching retirement. It is an afterthought when you're looking at what the future is going to look like. However, when you look at the ranking of costs or expenses in retirement, healthcare will rank as the number 2 overall expense. And at some point will probably, depending on housing, could become the largest expense. And it's going to be with us for once we turn it on until we're no longer here. So what we like to say, it's either number 1 or number 2 expense for the longest period of time in retirement. And it is important to plan ahead for that.
And is your work with the Retirement Institute and your experience tell you that most people underestimate the costs when they do begin to think about it?
Yeah, the Retirement Institute has a Harris poll every year where we poll usually over 1,000 people who are approaching retirement and ask them, can you project, or if you were to project, and we give them multiple choice answers, how much do you think you're going to spend in retirement? And unfortunately, we give an answer that would be not sure, I can't estimate it. And so far every year, that's been the number 1 answer, simply because they don't know where to go to find the dollar amounts. They don't understand the pieces that they have to add together. And then the second biggest answer, unfortunately, is a dollar amount that is too low or lower than the average cost of healthcare, which, as you would know as the advisor, hey, I need your budget. What is it going to be? And if they have the wrong number in there for healthcare, they're going to come back to you and say, hey, guess what? I need another $5,000, $6,000, $7,000 because I got healthcare.
Yeah, it could be a very impactful adjustment that needs to be made.
Yes.
And it's a difficult topic, it seems to me, Tim, because when you think about other, I'm going to say again, more fun stuff like, oh, I want to travel, I want to fulfill my quote unquote bucket list. If they spend a little less, it means mostly that they chose not to, hopefully. And if they spend more, it's usually because they're getting after it pretty good and life is pretty good. Now, there may be the financial element to that, but in healthcare, it's a little more out of your control. And some people may not have healthcare costs that impact their budget. And other people might have healthcare costs that run the risk of wrecking their nest egg. So it's kind of a tricky thing to plan for, no?
It is. And that's why, just because of the sheer numbers of people and actually where the market has gone, because what we tell everybody is this is an issue that we have going forward. But if we look back, it's an issue that our parents and grandparents didn't have, because companies used to give you health care in retirement. Remember? And it didn't really
Yes.
matter where you worked. You could be at an airline or a bank or a department store, and you retired and they said, stay on the healthcare. But now companies just can't do that. It's too expensive to keep 65, 70, 75-year-old non-working people in your overall healthcare plan because it makes the cost astronomical.
Yes. And I'm 50 years old, Tim, and other than people that I know, clients and friends and family, unless they work for school system or they work for state or federal government, they are very likely to be on their own for healthcare in retirement, where they're going to have to get either COBRA or personal insurance, individual insurance, I should say, or they'll go on Medicare and not have a backup through their employer. So any sense, I mean, that's pretty common, right? Less and less people are covered by their employer healthcare plan in retirement. Do you have any color on
Yeah,
that?
and again, we work with EBRI, and we get a lot of their data. We also work with and the data from Medicare, and the trends that we show are right now about 14%. Doesn't matter what size company, small, medium, large, international. Only about 14% of companies will have in the retirement package that you can stay on the plan, because if, again, back to the point, if I have X number of people over the age of 65, what does that do to a 25-year-old employee? It's going to make their costs go through the roof because we're carrying this other group at the other end. So even at Nationwide, if I were to leave Nationwide, I'm going to be on my own for healthcare.
And that 14%, is it fair that if we forecasted that out in 10 years, that number is much more likely to be lower than higher, right?
100%, yes. It's because it's gone down basically every year,
Yeah.
and it's more of the norm. And even you talked about teachers in public sector, state and local. There's even a move now in state and local where new employees now, let's say they're entering now, everybody else is kind of grandfathered in. But I work with a lot of different major counties, especially in the Southeast, and they're adopting the same practice now. You'll have healthcare while you work here, but once you get to a certain point, you're not going to be able to participate like, let's say, your dad or mom got to when they worked for the state.
Yeah, and I estimate that that trend will continue given the budget difficulties so many states and local governments are having and will likely continue to have. So
Yes.
I want to go back. You said that healthcare, I think you said healthcare ranks number 2 in the pecking order of retirement expenses, right? That's what.
Yes.
So what's I'm just curious, what's number 1?
Housing at the
Okay.
time, but as we see, what we see is people downsizing or eventually paid off. So that at some point, healthcare can actually step up to number 1 based on, again, a couple factors. As we get older, we'll need it more. So we have additional co-pays and different things that will come into play. But the other thing is just what the inflation rate on healthcare is completely different than what we're used to for inflation at the grocery store. So as we go through and get older, it simply is going to keep going up and up and up at a greater rate than general inflation. So it's going to cost.
Yeah, and that again speaks to that trickiness of planning to try and forecast what may or may not happen, combined with what costs might be, trying to take into account healthcare inflation. You know, we used the term earlier. It's a really tricky part of the retirement planning, income planning aspect of work we do for clients and the support you give to advisors and their clients. So can you put some numbers on it? According to the research that the Institute has done, what's the estimate over, say, let's say a 20-year period, what the total cost of healthcare might be? And, you know, recognize, listeners, that yeah, you're going to see numbers that could be higher than the number we're talking about, lower. I just want to have kind of an idea for us instructionally. Sure. So what would you throw out there?
Yeah, and let me preface it by saying we're going to look at a couple, so it'll be 2 people, and awesome. We'll go on that 20-year time frame. So that's basically, if you kind of combine it, I want to frame it around 40 years of healthcare premiums, right? Because the number I'm going to give you is going to be large, And what we have to understand is it's not a lump sum number where you pay it when you turn 65, right? You don't ever write a check to Medicare and prepay everything. You're paying either quarterly, monthly as you go through the year. So the research says a 65-year-old couple living through what we call full retirement, let's say 20 years, they're going to spend out of pocket anywhere from $295,000 to $365,000 out of pocket.
And
for their premium.
does that include potential long-term care expenses like in-house skilled care or unskilled care in the home? Is that included in that?
No, and that's the other thing that we try to kind of educate clients and your listeners on is Medicare. Think of it as strictly healthcare. So I go to a doctor,
Right.
I go to outpatient services, I can go to a hospital, but if I need any type of long-term care, there is nothing to purchase with Medicare to cover you at a nursing home. That's a completely separate expense outside of Medicare. And Medicare, what I use the example of is if you're in a hospital and Medicare is paying, but you then come to the situation where the hospital says, this is as much as we can do, they're going to have to go somewhere else, which is either home and you have to have someone care for you there, or to a nursing home. Medicare just stops paying, unfortunately, because they're not set up to do anything with long-term care.
Understood. So 295,000 to 365,000 would be a good estimate range for a couple retiring at 65, going through a traditional retirement cycle of 20 years. I have those
Correct.
numbers right? Good.
Yes, sir.
That's good. That's good to work off of. You mentioned Medicare, and I am not an expert in Medicare, but we do a lot of consulting with our clients when they get to age 65. I understand that Nationwide talks about how there's two choices, at least main choices about Medicare. Can you touch on that, please?
Sure. What I usually kind of, for people to visualize, if you think of a piece of paper, you have right side and you have left side. So on one side, let's call it the left side, that's where we have original Medicare. Original Medicare is when you sign up and get your Medicare card. Built into that is Medicare's Part A and B. But that's not full coverage. That's only going to cover you partially at the hospital or at the doctor or outpatient services. So what then you have to go physically find and purchase is a supplemental plan that helps pay what A and B will not pay for you at the hospital or the doctor. Now, the final thing that you're going to need to make the package complete is, I've mentioned hospital, I mentioned doctor, we have the backup, but we haven't covered prescription drug yet. Again, you have to go out and find that piece and add a prescription drug plan to that package. So that will look like traditional healthcare, okay? But we have to add those all together. Now, you have another form of Medicare, which is, it's still Medicare, but it's a package product. So when I'm with original Medicare, I'm working with the government plan, then I'm going out to a third-party vendor for that supplement that I mentioned, and then for that Part D prescription drug. Well, now over on the Advantage plan side, you're working 100% with a third-party insurance company. So if you take the big names, Humana, Aetna, Blue Cross, you're going to go to one of their specific Advantage plans based on your geographic territory. So as you're sitting in the Northeast and I'm sitting in the Southeast, if I were to go look and say, what Advantage plans do I have where I live? And you got your list and we matched them up, they're going to be different.
Gotcha.
Because basically an Advantage plan, the insurance companies come into a state, they look at the county, they go to the major healthcare systems in your county and say, okay, I'm going to put a pricing structure together for this. Meaning, if I buy that plan, I have to go to that healthcare provider. I can't go across the street to the other hospital that's a different system because I purchased this packaged product. So it's an in-network type of scenario.
I see.
So one side will be packaged. They're going to tell you where you can go, which is still fine. You have doctor coverage, hospital coverage, specialist, and prescription drug is all built in there. But what we caution people about is, how much are you going to, we talked about travel, right? How much are you going to be traveling? Where are the grandkids? Where is family? Are you splitting time? is an Advantage plan going to be able to help you with that if you're going to be in two different places because your coverage, you may be out of network versus traditional. If I go with traditional Medicare, I can go anywhere in the country that accepts Medicare. There is no network. So I could purchase everything down here and then come up and visit you. And if I go to the hospital up there and I have traditional, there is no question. There is no out of network or surcharges.
So that's an important consideration when making a selection. And these different component costs that you laid out very clearly, by the way, that was a great explanation. I imagine there's different component costs that also need to be factored into the decision making, right?
Definitely. And again, the way a lot of this is marketed, it's marketed on cost. So people will kind of get, caught up in, oh, looks a lot less than so A looks a lot less than B. You have to think though, it's insurance. So if it costs less, I have to be giving something up, right? So when you talk about like the supplement plan, we always encourage people to look at the most complete supplement plan, which is, they all go by letters, so it's going to make it a little confusing. But plan G for supplement, G as in George, that's the most comprehensive plan that will help cover all of your costs. You can go less, but you're going to be exposed to some costs that you may have to pay, where G would pay that for you. And then the other thing that we had mentioned is going out and finding Part D. So if you look at averages, an average G plan across the country can be anywhere from $150 to $225 per person per month. Your average, depending on what, and again, you got to think about what scripts do I need. If you're strictly generic, we can get you down into the $20 to $30 generic plan. If we start going brand name or specific drugs or higher tiered, we're going to be moving up into the 40s, 50s, and $60 per person. And that's why with what we'll talk about, we have the ability to kind of gauge on what you're going to need to give you a better idea of the cost.
So you said the average cost for a supplemental policy, which is meant to complement whatever Medicare choice you select. Is that right?
Well, on traditional.
Yeah, on traditional.
So the supplement's going to back up hospital A and doctor B.
So you wouldn't get the supplemental if you selected Advantage.
Correct. Advantage has everything packaged together.
Okay.
There is no, yeah. And you really can't have both. So when I say about being on that piece of paper, you got to be on one side or the other. You can't combine them and you can't have both.
And the supplement's only on the
original Medicare
side.
Yes,
and how many people have supplements that are eligible to get them because they're on the right side of your ledger that you described?
Hopefully everybody. Hopefully everybody. Just because the exposure.
Or not so much?
No, most people do. Most people, because in the reason for that is, rule of thumb, if I were to get just my Medicare card, my original Medicare card, and I don't add those pieces that I mentioned, and I walk into the hospital, that bill is only going to be covered roughly between 60 to 65%. And Medicare will tell you that up front. Say, look, we're going to cover 60 to 65% of your cost. You're on the hook for the rest. So here's our approved vendors that sell supplements. You really need to go research this and purchase one.
Understood. So it's widely adopted. That's good to know. I was not sure about that. And I want to talk a little bit more about the resources the Institute provides, because as we've said a couple of times already in this discussion, this healthcare planning part of retirement planning is more tricky than I think some others. Plus it's less fun, which we've also already stated.
Correct.
But you guys have some good resources, and I've used this in my practice. So I'm looking forward to hearing you talk about it for my listeners. You guys can do a cost assessment, a personalized cost assessment. Could you kind of just give an overview of this resource for me, please?
Sure. And what's unique about all of this is Nationwide, as you know, is a massive insurance company, but we actually don't sell health insurance or Medicare pieces and parts. But what we've been discussing, just having and understanding the importance of the cost, we've gone out and we've partnered with two companies, one on the software side with this Health View Services, and the other one is an actuarial firm which is a Milliman and Company, to say, hey, here's what we want to do. We want to kind of ask some questions in general, but we need the data across the country because things change geographically and demographically on cost. So we have a very simple personalized questionnaire. It's a one-page fact finder that you can fill out. You don't have to go to a doctor. This is not medical underwriting. We don't need anything. You can basically fill it out when you're sitting in front of us, which we do. And then we just run that based on a couple different things. Current age. When are you actually going to turn on Medicare? Because not everybody turns it on at 65. You don't have to. So people may work till 70 and turn it on.
If you're still working and you're covered adequately with your employer-sponsored health care, you may opt to hold off on Medicare.
Absolutely, because it could be a cost savings. If it's great coverage at work and you're still working, you may have a younger spouse. You may have to work until the spouse gets to 65, and that's fine too.
Gotcha.
So we're going to figure out how old you are now. When do you plan on turning on Medicare? We're going to have some healthcare questions that are very general. What that basically will help us determine is if someone's completely healthy. So you go and fill your question out, and Chris, you're completely healthy, but I have high blood pressure and I have high cholesterol. It's not getting me approved or disapproved for Medicare, but what it's telling me is, guess what? I'm going to have to go to the doctor more times throughout the year than you. That's going to be a cost. I'm probably going to have 1 or 2 prescriptions. I'm going to pay more out for through the year than you would. So we use that to kind of embed some more of the cost that someone who has a condition is going to have. And that's why we use those 2 companies. They have all that data for us.
And one of the things that I like about the assessment that you provide to me and my clients is that it's broken down geographically, right? Because if somebody is in San Francisco or New York City, the cost profile for healthcare services are often different, read that as higher, than if you're, say, in Alabama or different parts of the country. That's a great feature, I think.
Absolutely. And we tell everybody the 2 things that you need to factor in are demographics, which is think about where most of the retirees end up. So if you have a higher demographic population, the insurance companies are allowed to charge more. It's just the market, right? And then geographically, where everything costs more in the city is what we tell everybody. So as you said, the more metro areas are going to cost more. Then we start to get outside. We start going through the Midwest, it's probably going to be a little bit less. But your Floridas, your Northeast, your Arizonas, Southern California, then major metro cities like Chicago, Atlanta, New York, they're all going to be more expensive in general.
Yeah, makes complete sense. Again, that's a great feature. In the time we have left, Tim, we did an episode with your associate focused on health savings accounts, HSAs. And I think this is a topic that's increasing in importance because more people are using them. And that means that more people, more money is being accumulated in those vehicles. And I fast forward, 10 years ago, I didn't talk about HSAs much in terms of the retirement planning conversation. Do more of it now. And I imagine in 10 years, it's going to be a mainstay topic point. So can you touch on, at least broadly, how health savings accounts interact with Medicare as part of a tax efficient retirement income planning tool?
Sure. The greatest thing about HSAs is that it's the only way you can take $1 and defer it pre-tax. So you can contribute pre-tax, let it grow tax deferred, and then take it out tax-free.
Yeah,
so the question I always,
tax-free.
Yeah. So what I tell everybody is, are you ever going to spend $1 on healthcare and retirement? Right. That's a loaded trick question, right? You're going to spend $1 at some time on healthcare. Well, why wouldn't you want it to be triple tax-free? Mm-hmm. And in doing that, if you have that health HSA account, you can use that to pay part of your premiums on Medicare, except for you cannot use it for your supplement. Mm-hmm. But if you have your Part B premium that you pay, if you have a deductible that's out there, your copay from your doctor's visit, it's $25 every time. You can reimburse yourself on those costs through your HSA, which is a phenomenal vehicle to use it for.
So when you talked about the components in putting together Medicare, we talked about the different components. Even though HSA isn't directly under the Medicare, it wouldn't be on your sheet that you described earlier, it is actually a complement to the Medicare choices, and it's a nice tool if you've been eligible and have taken advantage of accumulating money in HSAs. It's a great additional resource in retirement. Is that a fair way to look at it?
If you have the ability to participate in an HSA, it's an extremely powerful vehicle to help complement the rising cost of healthcare with Medicare. It's absolutely vital if you can do it, to have that working in conjunction when you start accumulating these costs over here on your Medicare pieces and parts. Yes.
Do you think, going back to what we talked about at the top of the show, now that we've kind of gone through some really important information for everyone, do you think people don't pay attention to the healthcare topic in retirement because it's just so distasteful and it's usually associated with negative outcomes? How much of this is a psychological, emotional, like, just, I don't even want to go there kind of attitude?
Well, I think that's definitely some of the reason I don't want to go there. I really want to look at what I'm going to be able to do in retirement, not what I have to pay for in retirement. That's where we are with Medicare. But a lot of people have a misconception of, as they're working, what healthcare really costs, right? Yeah, I mean, everybody's seen their group health insurance go up, but when that goes away, what are you actually going to buy? Like, how much is it? And they think, well, it's kind of like what I'm doing at work, right? And a lot of times it's not. And so they think that, I can just flip this switch and jump over here. And then a lot of people are shocked by what it really costs. Now, in saying that, Medicare costs are the lowest coverage as far as dollar amount that you can get. You're not going to want to private insure at the age of 65 or 70 because it's so expensive. But a lot of people moving from that group insurance at work, they think, I'm just going to jump over here to Medicare. And then they're like, whoa, I didn't know it was really that expensive.
We see that a lot, Tim, in working with clients who are able to retire earlier than 65. A consideration is, what do you do until you get 65? Can you get on COBRA? Do you go on the exchange and get an individual policy through the Affordable Care Act marketplace, also known as Obamacare? And that's another element of this tricky proposition, because there's no silver bullet solution in that instance. But sometimes people financially and emotionally want to retire earlier than 65, but we're going to have to figure out healthcare at least until 65. And even at 65, as you outlined, there's going to be other choices in terms of Medicare and the different components. But that phase between when you retire early and 65 also needs to be dealt with.
Definitely. We call that the healthcare hurdle. We talk a lot about that in Social Security when we talk about that. A lot of people think their vision is, hey, 62, I'm eligible for Social Security. I've worked here long enough. I'm going to go ahead and go. And I just have to ask them a simple question that we talked about already. If you stop working, do you lose coverage? And if they say yes, did you price what coverage is going to cost for the next 3 years? I'm not trying to change their plan, but that's a huge hurdle as far as cost just for a 3-year period. So I agree with you.
You want them to make an informed decision, and you do not want them, as a financial planner working with clients, you don't want them to make a decision and then a couple of months out have regrets because something comes to light that really blows up what they were planning on. So
you're exactly correct. Yep, you're exactly correct.
So Tim, this was terrific, good information. As I've done with your associates, I want to thank you personally for joining me today. And I want to thank Nationwide for their support of my show, and the Retirement Institute in particular for providing me this wonderful resource for the Simply Financial podcast. And for listeners, if you want information, including about the Fact Finder, about any of the topics we discussed, please go to my website, elliottwealth.com. You could sign up for a consultation there right through the Calendly link. I'd love to discuss these and other things with you, how we can help you make good decisions and win with money and plan properly for retirement. So again, Tim, thank you so much.
No, it was my pleasure. Glad to be on the show.
Yeah, and listeners, I'll be back with you on the next episode of the Simply Financial podcast very soon.
The views expressed are not necessarily the opinion of SagePoint Financial Incorporated and should not be construed directly or indirectly as an offer to buy or sell any securities mentioned herein. Investing is subject to risks, including loss of principal invested. Past performance is not a guarantee of future results. No strategy can assure a profit nor protect against loss. Please note that individual situations can vary. Therefore, the information should be relied upon when coordinated with individual professional advice. Please note, the information being provided is strictly as a courtesy. When you link to any of the websites provided here, you are leaving this website. We make no representation as to the completeness or accuracy of the information provided at these websites, nor is the company liable for any direct or indirect technical or system issues or any consequences arising out of your access to your use of third-party technologies, websites, information, and programs made available through this website. When you access one of these websites, you are leaving our website and assume total responsibility and risk for your use of the websites you are linking to. Securities and advisory services are offered through SagePoint Financial Incorporated, member FINRA SIPC. Insurance services offered through Elliott Wealth Management, LLC, not affiliated with SagePoint Financial.